Hi everyone, and welcome to today's webinar on bypass taping of the foot. My name is Sarah Gill. I'm a lymphedema practitioner. I work in private practice in country Victoria, and I treat a real mix of patients. I treat those with acute lymphedema to also those who require really long-term management. A reminder that today's webinar is recorded, so you'll be able to reference it again. So don't feel that you really need to take a lot of notes. You'll also be sent a recording of it. So just really try and follow what we're doing. I'll be taking questions at the end of the webinar, and would also like to direct you to our website, which is mobiderm.com.au, and that has all of our product guidelines plus information on more case studies. I would also like to take this opportunity to give you an introduction on the companies that are offering this webinar today. Medical Rehab was established in Victoria, Australia in 2010, and it is the sole distributor of the MOBIDERM range in Australia. It is committed to providing therapists and patients with not only high quality product solutions, but also with ongoing support and education. Medical Rehab also stocks rehabilitation products, knee scooters, body supports, and more. Tuan is a French company that was founded in 1847 and is the manufacturer of the MOBIDERM and VenoFlex range. Every product is designed with close collaboration with those involved in medical treatment of the patients, and Tuan creates and distributes medical devices that enable patients and consumers to be active players in their own health. Medical Rehab is proud to be the sole supplier of the Tuan lymphology range in Australia. So today's webinar is on bypass taping of the foot. And what I'm going to do is give you a little video introduction first of all on the products. Then we'll go through some theory, and then I'll show you a more extended training video. So I'm just clicking on the slide here. Right, so what we've got today is our introduction, which we've just done, our products, how MOBIDERM works, and then we'll get on to the taping of the foot. Now, a lot of people ask me about these products and how I use them, everything like that in my practice, and I really enjoy taping of the foot. I do taping of the foot whenever I'm doing a bandaging of the leg. And the one thing I have in my clinic to start with is just a set of products. So this is direct from the clinic to you, and it is my taping box. So in this box, I have everything that I'm going to need to tape a foot. And that makes it really easy for your patients to access and for you to be able to do it. I think it's much better option if you have the products there, because if the products are there, you can then just charge the patient, and we'll get on to the costs of all these things at the end. I'll go through a cost structure and how I actually charge my patients for it. From that box, I'm going to show you quickly what these products are so that when you see them on the slides later, it'll make a lot more sense. So first of all, I have this. It's a protective underlayer. It's sometimes called the Muster Protection. It's really fine and thin. It almost feels like a bit of stocking net when it goes on, and it's quite bouncy as well. So this is really important because bypass taping is an adhesive compression tape. So we don't want to put it directly on the skin at any point. It must go onto the mousse. And you'll see in the training video how much mousse I put on. So this is our protective underlayer that has to go on. The next part I have in my products is my MOBIDERM. And for the hand and the foot, we use the small squares of the MOBIDERM, and that is because we've got less tissue structure, like less muscle structure. So we use these smaller squares, and they actually stimulate better. And this comes in a 25 centimetre by 25 centimetre sheet, and you'll see here I've already chopped some bits out. So this is the sheet that I purchased, and I have it for my patients that I actually cut out the shapes for the foot. And you never throw any pieces out because you can always use it again. Then what I've got is the bypass tape itself. Now this bypass tape comes in a roll, and the roll is, this is a 10 centimetre roll, and it comes in 2.5 metres. You'll see that it has indicators on here, and these indicators actually show how to rip and open the tape. Now this tape is very different to lymphatic tape or K-tape or anything like that. It's a real compression tape, but it also has a slight open weave, so it is really quite movable. So here is my tape. Now what I'm going to do is, this is what I prepared earlier. I've ripped it, I've opened it, but I want you to see here how much I can actually open the weave. So when I put this on, it is with complete force. So you see how stretchy that is? So that gives and moves against the MOBIDERM, and that's where we get that stimulation. So I've got my mousse, my MOBIDERM, my 10 centimetre bypass tape. Then to finish, I have a 3 centimetre bypass tape. And this again comes in a 2.5 metre roll. And for this one, you'll see in the videos, we use this mostly as stirrups or for around toes. And I do that. And here again, you'll see that stretch. So when we put this tape on, it's with maximum stretch. So what we'll do now is that I'll start to take you a little bit through how MOBIDERM works. I'm going to say goodbye from the video and we'll go from there. So here is the complete range that I was just showing you before. So we've got our Mousse Protection or our under wrap. Then we have our bypass tape, which comes in the 10 centimetre and the 3 centimetre, and also my sheet of MOBIDERM. I keep in my box as well some form of like K-tape or lymph tape or one of those kind of tapes that you can just lightly use over the toes. So you'll see that in the videos we use bypass taping of the toe, but sometimes I might just use a little bit of lymph tape. So this is all the products you need. And the best thing about this adhesive compression tape is that once it's on, it can stay on for about 3 to 5 days. This is all you need. So the product costings, and you can get all of this on our website at mobiderm.com.au. The sheet of MOBIDERM in a 25 centimetre by 25 centimetre sheet is $30. The protective under wrap is $7.50, so it really is quite cheap, and that is for a 27 metre roll, and you can just get so many feet out of that. It's really cost effective. The bypass tape is $10 for the 3 centimetre and $20 for the 10 centimetre. So usually in my kit at work, I've got one protective under wrap, I've got 2 10 centimetre tapes, 3 3 centimetre tapes, and a sheet of MOBIDERM, scissors and a little bit of lymph tape, and that's all I need. On the next slide here, I just want to take you through again what is MOBIDERM very quickly. So MOBIDERM is an open cell foam and it's in an adhesive non-woven fabric. And if you think that MOBIDERM is mobilise the dermis. So what we get is this mobilisation on the skin. And you'll see in this slide here, we've got the areas of muscle, and these green arrows, what they actually show are the areas of pressure. So you've got the MOBIDERM, then your bandage or tape on top. So in this case, we've got our bypass tape on our 5mm square MOBIDERM. Then we've got the movement of the foot underneath. And what happens is those tiny little squares move down and across in a shear effect onto the skin. When that shear effect happens, it actually pulls on the collagen fibers, which then open up those initial lymphatic vessels. So those initial lymphatic vessels, once they're open, they'll start to draw in some of that lymphatic fluid. We'll then start to pulse that into the next part of the lymphatic system, and it really does help to stimulate your lymphatics, not just to compress and stop filtration. So The best way to do this taping is with the MOBIDERM underneath, especially for the first time that you'll do it. Now, these videos are all available online, and you'll be getting these slides again as well. So we as therapists know that once we start to stimulate our lymphatic system, it's going to work more effectively, and then we might even find some anastomosis to go through. So why tape the foot with BiPlus and MOBIDERM? So you can see on these images, we've got traditional multi-layer foot bandaging. Now, I don't know about you, but I've done this bandaging a few times, and doing these crepe toes on the left-hand side with that bandage, that is really quite difficult to do. So it's very fiddly and it's very time consuming. It's also difficult to actually gauge the type of compression that you're putting onto the toes. So what we want to do is actually give an even amount of compression and really control what we're doing for the patient. So the other thing is that once we've got all of this bandaging on, because that's just the toes, then we have the foam protector, then we have the other multi-layer, it's actually quite bulky and difficult for the patient to wear a shoe. And after a time, when the patient is walking, it actually starts to shift. So what that means is that the patient can fall, you're not getting the amount of compression that you want, and it's just going to give a little bit too much. It's also something that if you wanted to, say you live in a regional or rural area, or the patient can't get back to you at your clinic for rebandaging, to rebandage a foot is really very difficult for a lay person to do, but to rebandage perhaps with MOBIDERM from the ankle up is not too difficult. So if we can then actually tape the foot, what we find is that it's much more advantageous for the patient and easier for the patient then to have some continuous days of bandaging, because they're not having to actually replace the foot bandage. We've got 3 pictures on here. The first picture is of a completely taped BiPlus foot. The second, and you can see how small and compact that is. The second image is where we've got some mister protection, and it's putting some of these MOBIDERM pads around the foot. And then our third picture shows some treatment after 5 days. Now, I've seen feet like this go down that fast with taping, and I think one of the reasons why is just that it can be very difficult so difficult to bandage a foot that the patient isn't always, you know, they're not wanting to really partake in that process. But if you say, we're just going to tape the foot, you do it once and it can stay on for 3 to 5 days, the patient's able to walk around, the patient's able to put a shoe on, they're much more likely to do that process. Also, you can grade the compression as you put the tape on, and you can actually bend it over those bulbs that you can see that you sometimes get on the foot. So the great thing is when you're putting this tape on, it's really adjustable to apply. You can move it around corners, you can put extra bits on where you need to, and it's actually really easy for the patient to wear a shoe afterwards. With the MOBIDERM underneath, that actually starts to stimulate our lymphatic system as well. So the patient is getting the compression, which is going to restrict the filtration process, and then they're also getting the stimulation of the lymphatics from the MOBIDERM as well. The tape is comfortable to wear because you would have seen, remember that stretch that I was showing you at the start? It gives a little bit. It's not very stiff, and we don't want anything with MOBIDERM to be stiff because we want it to help to get that shear effect onto the tissue. It also doesn't shift when the patient is walking. So the patient can even walk around in thongs, they can walk around in sandals, they can walk in their feet just with the taping on. It can be worn for 3 or more days depending on the patient movement. So I've had patients who have worn this for 5 days, and as the tape started to give a little bit, I've just given them a few extra strips and they've put that on over the top to keep that compression happening. It's also really time efficient for the therapist and the patient. So what that means is that the patient isn't having to come back to you for rebandaging of the foot, and once it's on, it's on. It's also very easy to remove if needed because you've got the mousse all the way under the foot, so it pulls off almost like a sock. So what I'm going to take you through now is actually the process step by step for taping of the foot. And then I'm going to show you a training video. Now these slides that you're going to see now, we've actually got them in PDF format to download on the website, which is at mobiderm.com.au. Now, the one thing we just want to make sure to start with is if somebody has a real bony prominence on the back of their, the attachment of the Achilles, we might want to put a little corn pad or just put something like a Band-Aid, bit of Vaseline, bit of something just to protect that, because it is going to have a bit of compression on it. And when I tape, I then also dorsiflex the foot, and I often at times get the patients to move the foot up and back so I can make sure I'm getting all of the coverage. So once we've done that, I then apply a layer of protection with this protective underwrap, and that becomes at a 50% overlay all over the foot, and you'll see that in the video. Then what I do is I cut my strips. So all I need are the two products. I need my 10cm roll and my 3cm roll. And really the theory behind it for both is the same. So my first strip of the 10cm, I just measure from one side of the foot across the top of the dorsum to the other. And that's going to give me my first cut, my first strip of length. My next one I add 3cm to, and the next one I add 10cm to from the first strip. So what that means is I've got a small, a medium and a long. Then for the 3cm strips, from the ball of the foot, I run the 3cm strip around the bottom of the heel up to the bottom of the little toe. That's my first strip. I then add 2 centimeters to that, and then 10 centimeters to the first one again. So again, I have a short, medium, long of the 3 centimeter. And this is what I do with those strips. So I take my first 10cm strip, and what I do is I really tear it down the middle and I hold it between two ends. And it's really important that you're quite aggressive when you open up this, and it's got the indicators onto it, because if you aren't aggressive, if you just try and do it gently, it's really difficult for it to open. So you grab it at the top and you really rip it and it will open out. So once I've done that, I put my first 10cm strip over the foot, and you can see that up on the top left-hand side. Now, when I'm getting the patient to do this, I'll actually get them to point their toe towards me like a ballerina, because I want to make sure that I'm covering that gap between the toes and the start of the foot. So that's, I've got my first strip. Then I just do the second strip of tape, and I put that about 1 centimeter back, and then the third strip. So I'm getting a layering effect all the way through. The important thing is that you'll see in the video as well is that I put these on at maximum stretch. So all of this taping is applied at your maximum stretch you can do. There's no 15% stretch, 50% skin stretch, none of that. It's maximum stretch all of the time. Then with my 3 centimeter strip, what I do is just find that bony prominence at the base of the toe, and on the medial side at maximum stretch again, I take it around the medial side, under the heel, back and over the top of the toes, and then underneath the toes and back. And that's my first strip. And what this does is start to build up some compression at the heel, but it also acts as a stirrup so that the taping won't shift at all. And this is all really easy to see on the video. The video that I'll show you today is quite an extended video, and we've got a shorter one again on our website that you can use just as a refresher. So here's my second strip, and you can see I just started about a thumb distance back. That's the darker strip there, and I do a 50% overlay up. So again, I'm starting to build that compression up the foot, and I'm also starting to really secure around the top of the foot. So if somebody's got a really bulbous foot, what we can do is get underneath that almost with this 3 centimetre tape. Then I put my next tape on, and here it is. So you can see the light grey, the medium grey, and then the dark grey, and that's my 3 layers. And the last 3 centimetre strip, because it is a 10 centimetre, it comes up and across and almost looks like a bit of a shoe as you get it all together. So it's really important that when you're putting this on that it is at maximum stretch. The other thing I do, as I said before, is I get the patient to point their toe towards me, because I want to make sure that I'm covering all the spaces between the toes and the actual foot. Once that's done, I just want to cover the foot to make sure nothing's going to move or get caught in socks or anything like that. So what I'm going to do here is, with my 10 centimetre roll, I cut 2 centimetres off the width of it, and then I've got some 8 centimetre strips. And they just go 1, 2, 3 up and around to the base of the ankle. When we get to the video, I'll talk about how we can adjust this to really bulbous ankles and to overhangs and everything like that. So the compression, when you have the 3 layers of 10 centimetre, the 3 layers of 3 centimetre at maximum stretch, you're really starting to look at a class 2, high-end class 2 to a class 3 compression. And if you don't want to have that much compression, what you do is just put in 2 layers. So you put in 2 strips of the 10 centimetre, 2 strips of the 3 centimetre. And remembering that, as you saw at the start, that because the biplast tape is really, really stretchy, it moves with the patient. So it's not like wearing tape like a sports tape that is so stiff that you can't move. This really moves with the patient. So what I'm going to take you through now is a training video that I've done before. Now, when I tape a foot, it takes me in real time about 5 minutes. So this video goes all together for about 20 minutes because I'm talking through it. I'm going to stop and start it at some times just so that I can talk through a few of the little features that I'm doing. And you can already see here that I've got all of my products ready to go to tape this foot. The person who I'm taping here, they've kind of presented a case study that they had a child, a paediatric patient had some swelling in their foot. So if you hear about me talking about a child at some point, that's the reference for that. So I will stop this and start as we go through, but we'll just start the video now. So this is going to take you through all of the steps that I've just done on those slides. So you can see there that I've put mousse all over the foot. And what I'm going to start to do now is measure up my pieces of MOBIDERM to get everything ready. And then I start to do the toes. So never be shy on the mousse. And as I said, that's a 27-metre roll. So, you know, you can even rip it off, put some more on, stop, put some more on. It's also really good for securing the MOBIDERM as well. So here I've actually measured up the amount of MOBIDERM that I'm going to put on over the foot, and now what I'm going to do is start to measure up those 10 centimetre and 3 centimetre rolls. So what I've got there is all of my pieces ready to go, and I want to make sure all the time that I've done all of my cuts and it's all going to be ready to go along, because now what I actually do is start with the toes. So it's important to note that just like before when you're doing traditional crepe bandaging or multi-layer bandaging of the foot that you start with the toes, it's the same system here. We always start the taping with the toes, but we just do our measures of the tape to start with so we have it all there and ready. And you'll start to see here how I do the taping of the toes with the 3 centimetre tape, and you'll hear me talk about big foot or little foot, and what I'm doing there is I've been speaking to the class about if they've got a foot with large edema, like a really solid edema on the top of the dorsum side. In that case, I use the 3 layers of taping all the time. But if someone's just got mild edema, or I just want to hold compression on the foot while I'm bandaging a calf, for instance, I will just do the 2 layers of taping that's on. So here we start to go with the taping of the toes. So it's important that when you're doing this type of taping or anything, that you're really using your practitioner's mind, and you can adjust this a little bit through. If the patient doesn't have any edema on the big toe, you can just put the tape straight on to hold, just like you would a crepe bandage. But you know how sometimes you'll see a big edematous foot and it has quite a big solid toe. I might want to see if I can reduce that a little bit, in which case I'll use a tiny bit of the MOBIDERM. So just like with traditional bandaging, I'm going to tape with a 50% overlay on the toe. Now, if the toes are particularly short, I will just use 1 piece of tape. And I never go fully around because we don't want to have any tourniquet effect. If I feel like that tape, I want to hold it a little bit more, what I do is put a tiny piece underneath the toe and around as an anchor. So you can see I've done one toe there. Now, unlike traditional crepe bandaging of the toes where you have to do every toe, with this kind of taping, you don't have to do every toe unless it really needs to be done. So what I'm going to do is start to do the next two toes going round, you'll see that, but I'm going to leave the little toe and the toe next to that out because they're quite stumpy and they don't have any edema, and I'm pretty confident they're not going to fill up. So sometimes these days what I'll also do is actually use a little bit of lymph tape where I just spiral it down, or K-tape, spiral it down from the nail bed to the base of the toe, and I can use that. But I always do bi-plus taping on the big toe and sometimes also on the second toe. So you can see there I'm starting to go through the whole toe process, just going down one at a time. And remember I said before that this is an instructional video, so it goes for quite a long period of time. It doesn't take me this long to actually tape a toe or tape a foot in real time. So there I've done the toes. What we're going to do now is just cut forward a little bit to where I start to actually place the MOBIDERM on the foot. So this is how you're going to be doing your toes. And you can see here I've done the first 3 toes in bi-plus taping. Now I start to do the foot. Now it's important here when you're taping to make sure you're using maximum stretch all of the time. So you can see there, I've actually used some mousse to go around. Oh, sorry about that. We've just skipped back one. Go back onto there. So I've actually used some mousse all the way around. And once I've got all of that mousse on and I've got my protective under wrap, then I'm going to actually start to get everything ready to do the taping. So you can see that now. Oh, you'll see that in a moment. Sorry, I've just got a bit of a issue here. I'll just go back to this taping of the foot. Sorry, I'm just going to have to go back again. I'll just put myself on video here for a moment. So yeah, sorry, just technical difficulties there. I'm just going to have to start the PowerPoint just again. But you saw there, I've had everything ready. I've done the mousse taping. I've got my bi-plus tape ready to cut. And now what I actually do is start to go through and tape the rest of the foot. So I'm just opening this PowerPoint again. Sorry about that, everyone. Just some gremlins in the system here. Almost there. Okay. So here I am starting to put the tape on. Can I hear you, Anthony?
Yes, I'm here.
Are you seeing these pop-ups?
Yes, I'm seeing the pop-up, so I'm not sure.
I don't know what the hell's happening.
It's keep on coming back. I'm not sure. You should be all right now.
I should be all right now. Will you be able to edit that out, maybe?
Yeah, I think so. I think we can cut this out, and you just restart back from where you were before.
Where I was, yeah, I know.
Yeah.
Yeah, I'll start back from there. Yeah,
Oh.
This is a school security computer. How on earth something like that pops up? I have no idea.
Yeah, I really don't know.
Okay, I'll go from here. All right, so I'll count 1, 2, 3, and then you'll know where to do it. 1, 2, 3. Okay, I'm going to just close and start again. One, two, three. So here I am with the tape, and what I'm actually doing here is I'm going to start applying it through. And you'll see here what I really love about using this product is how flexible and adjustable it is. Then I can actually move it around a corner. I can put it over an edge. So if somebody has really overhangs on their ankle, what I can also do is use the 10 centimetre but cut it into half, so I can use a 5 centimetre around the base of the ankle, and that's going to really help those overlays in. Like a lot of compressive taping or putting anything on the foot, it's so good to have a good product that their foot usually reduces pretty fast. So over 24 hours you will see some kind of reduction happen. And you can see there, I'm using maximum stretch all the way around. So if you do 2 layers of tape, just do 2 layers of 3 centimetre tape. So I'm just going to jump a little bit here. That's where we are, our 3rd strip. Just watch this again. So what I'm saying there is that you can adjust this all the time to your patient's needs. So you don't always have to do 3 layers, but at least do 2. You definitely need to do 2 to get that effect. So what we're going to do now is start to see the final section, and this is where I'm going to cut my 10 centimetre into 2 strips. So here you see I've actually completed the foot. Now I will remind you again that this was a training video. Usually it takes me about 5 minutes to do the foot altogether. I'd also encourage you to look at our website where I have a shortened process of like a 7-minute video of this if you just want a quick refresher on actually visualizing it again, how to do it. So what I'm going to do now is just see if any questions come through. So I hope you've all been writing down your questions as we go. And we'll see if we've got any questions here. Okay, yep, here comes the first one. Is there any rebound effect? Well, no, there's not. And the reason for that is when you use MOBIDERM, you're actually stimulating the lymph. So you're actually doing more than just restricting the filtration across back into the tissue. So I mean, if there is rebound, it's very, very minimal. You'll find that once the patient's foot comes down, it pretty much stays down. And maybe occasionally you might just give them a bit of tape for themselves at home. But I've found that this taping works so well on the foot. I've never found any rebound in my patients. So I'll just see if there's some more questions. Can this be used on ulcers? So I'd say venous ulcer, for instance. Look, what you want to do is just make sure that you have the ulcer completely dressed. You know, now I am not a wound nurse, so there is no way I'm touching any dressing whatsoever. But if you imagine you've got your ulcer, it's been dressed and sealed. If I put a lot of mousse over that and then I put the tape on top, you are going to get a nice bit of compression around that area. And with the MOBIDERM as well, you're going to get a better healing effect of that ulcer. So yes, you can, but certainly never directly onto an ulcer and never the mousse directly onto the ulcer. The ulcer needs to be dressed with a suitable dressing by a qualified person. And yes, you could do taping over the top. I would advise the first time just do 2 layers of taping for both, because we want to ensure that we're not putting too much compression in. Okay, my next question I've got here, do you always apply maximum stretch? Yes. Always maximum stretch. There's never any 50 or 15% stretch. It's always maximum stretch. If you want to adjust the level of compression you're putting into the foot, then you just put 2 layers of each tape, not 3 layers. So why do I leave a gap at the bottom of the foot when taping? So why we leave a little gap at the bottom of the foot is so that the patient can feel their foot really well on the ground, so they've got a good neuroreception when they're walking. And also I love the notion of body weight for compression as well. So if you imagine your patient is standing hopefully a bit of the time or doing their exercises, even if they're sitting, they've usually got their foot resting on something, so they are getting some compression up through the sole of the foot. So my next question is, what is the compression gradient? So when you use the full taping system of the 3 layers of 10 centimetre and the 3 layers of 3 centimetre tape, you're looking at a higher end class 2 to a class 3 compression. Now, the good point with this is that because it is adhesive and it sticks, it stays on, you don't get a lot of shifting of that compression as the days continue that the patient wears it. If their foot does reduce quite dramatically, which, you know, will reduce a lot the first time they do it, just give them some strips of 10 centimetre tape to put over the top of what they've already got on, and that's going to keep that compression feel. I always get my patients to get up and walk around the room with the tape on so that they get the feel of it as well, because once you walk with it on, that stretchiness really makes it super comfortable. Can you get it wet? Well, yes, you can, but if they're going to have a shower, put your foot in a plastic bag, try not to get it wet, especially if you've got the MOBIDERM in, that's going to get a little bit soggy. You know, if they splash it in a bit of water, that's going to be okay, but of course, no baths, that's not going to be good for it. The best way to remove it. Okay, so the best way to remove it, and you'll see this on the other training video we've got, is that along the sole of the foot, you just cut up over the 3 strips of 3 centimetres that's across there, and then because you've got all the protective mousse, it just pulls off like a sock in one piece. It's really great like that, very easy to remove. The toes, you just grab and they'll just pull off. Does it breathe? Yes, it does breathe. If you saw that open weave on the tape, so it does have some kind of breath, so that it doesn't get mouldy or sweaty or encourage tinea or anything like that. My next question is, I don't round the edges of the tape. I know where that question is coming from because on other tapes that we use in lymphatics, yes, we do round the edges because those tapes will peel up and get caught. This, we don't need to. Biplast is such a fantastic tape and it's so adhesive as a compression tape that you don't need to round the edges because it's not going to move once it's taped on. And now, what is my next question? Okay, what is the efficacy of MOBIDERM under? Well, we want to put that MOBIDERM under the tape because then we start to really get that effect of the shearing onto the skin, which helps to increase our lymphatic system. So we really want to stimulate the lymphatics, and that's how we do it, by putting the MOBIDERM under. If I mentioned before, if I'm just holding a foot for someone, a bit of compression in, I'm not going to put the MOBIDERM under, but certainly if they do have quite heavy edema, I put the MOBIDERM under the tape, that's for sure. Now, before we finish today, I'm just going to go over the cost and the colours again. So I've had a question here about colour, sorry. There is only one colour and that's white. So no other options there. I'm just going to turn my video back on. So I really hoped that everyone's enjoyed this webinar, and just a reminder that to order everything, you can do that on our website at mobiderm.com.au, and we're more than happy to send lots of tapes or little bits of tapes, whatever you need to start with. But the best thing to do is just to get using it on a foot. The more you use it, the quicker you get at it, and then you can do it quite quickly in 5 minutes. And certainly I've found that it's been very successful with my patients, and also in giving them a little bit more patient advocacy. It's a little bit easier for them to then do their bandaging at home that I would then bandage from the ankle up. So I charge my patients $10 a foot, that's Australian dollars, just $10 a foot. So I have all the products there and it's ready, and then I just say, okay, we're going to take your feet today, and I add $10 to the bill for me. And with things like the mousse, this mousse, that's what comes in a 27-metre roll. So if you can imagine, I'm going to get a lot of feet out of that. I mean, I really only need one of these in my clinic. The 3-centimetre tape is the one that you usually need a few more of, probably 3 boxes, and I'd always have 2 boxes of the 10-centimetre tape on there as well. Now we have, as I said, on our website, training website, we've also got some case studies there that you can have a look at, and we've got the ordering process and everything there that you need. So I'd really like to say thank you today for everybody for listening, and it's been a pleasure to present this webinar. Sorry if I had to restart those slides once, a bit of technical glitches, but I look forward to hearing all of your results. And if you have any questions about taping and all, please feel free to email info@medicalrehab.com.au, and then we'll be able to answer your queries for you. So thank you very much.